about the pericardium. I didn't know which one was the right answer.
Well, they're both the right answer. So it should have been squamous epithelium and connective tissue.
Okay.
Okay? Does that make sense?
Yeah.
But
this is the squamous epithelium.
Is it also known as the serous?
Yeah. You
Serous.
can put serous membrane too. That'd be fine.
Okay.
So it didn't have to put the cell type. I could have just put it underneath like a.
You could put serous.
Serous. Okay.
Serous and connective tissue. Because I asked for the tissue type, not necessarily the cellular type. Right?
Yes.
But you could have put simple squamous epithelium. That would have been correct. But if you also had, you should have put the connective tissue.
Okay.
If you didn't put connective tissue on there, it's not really 100% correct. But
So
I gave you the point anyway.
Oh, thanks.
Because I am that kind of person.
I need a whole bunch of points to even make that test worth anything.
Right, so you have the pericardium. And where's the epicardium?
Right here.
Alright,
Outside one.
the endocardium.
The inner.
And what does the epicardium mean? What kind of tissue?
It has to be the lubricating kind too, right?
It's the same kind.
Oh,
it's
all the
serous,
same.
It's squamous, simple squamous.
Except for the very inside, it's the smooth.
No, and even in
No,
the
it's
inside
all-
it's
The
squamous
inside
too.
is. The only one that's not is the myocardium,
Okay,
which is
that's the
cardiac
myo-
muscle.
okay.
Right?
Yeah.
And if people just put cardiac, that doesn't mean anything to me because it doesn't give me a cell type or a tissue type, right?
Myo.
So cardiac muscle is important.
So myocardium, and it's made out of what cell?
Cardiac.
Simple. Oh, the myo, yeah, cardiac, and then the other
And
ones are
what
simple.
cardiac muscle cells look like?
They are branched shaped. I
Yeah.
knew exactly that. I had that down. That was my favorite part of the test.
Yeah,
I
you
drew
got it
little
right, but
pictures.
there were a few other people who got it wrong.
I
drew
don't know what I
little
put for
pictures.
Don't
that.
look at me.
Because I
That whole
remember,
test was a
and
fail.
I even highlighted the different
Is it hard
muscles
saying that?
and everything too. So I remember that he said this is important for an exam, and I started in my book and I studied that.
Well,
I felt very confident with that
nobody got
statement.
an A on that exam.
Oh, I know.
Oh, I don't think it.
Which I was surprised by because, I mean, I thought it was fairly straightforward. But
It's just a little confusing. We thought there was going to be tissues on there.
Yeah, I
there
thought.
was issues on there.
Yeah, we thought it was going to be more on like, skin layers or. Because we went over that in class. Like, that's kind of what. Well, it's okay. Moving on. Left ventricle and the apex.
The left is down here.
You have to make sure it's not the. You have to make sure it's the ventricle,
Yeah.
not
And
the
the-
atrium.
Because this is in the.
The ventricle is on the bottom,
Hold
the
on.
atrium's on top.
Yeah, but.
Right.
My
Like
bad.
that. Like that.
So in the
Would
apex.
be here.
Yeah. And the right atrium
Which side do you want?
and the auricle
The back here and
Yeah.
here.
The other oracle?
and the right ventricle.
That's on the bottom, right?
Yeah, it's hard to see because it's so tiny, but it's just this little thing here, right?
Yeah. The best way to think about it, all right, is this is the left ventricle. The right ventricle comes around like this, so it's like a moon.
It's better if you look at it like in
Oh,
the
it
middle
is like a
first,
moon.
and then you kind of.
Yeah, you can see it way good
Yeah.
here.
So you just think about it like this. Just make your fist into this. Here's your apex of your ventricle, right?
Apex
And
is
then
the bottom.
and then we've got the right ventricle scooting around the outside, just like that.
It's easier, like if you look at it in the middle first, it's easier, and then if you kind of.
Yeah, you can see the moon shape around that.
Yeah.
That's really great.
Okay?
Okay.
So that's the best way to figure it out.
Now the vena cava.
Oh, one thing I didn't tell you is where's the septum? Can you tell me where the septum is?
I don't know. I'll keep my mouth
It's
closed.
what divides the right and the left side.
Right, exactly. So show me in the show
So
me
the
the
septum
ventricle.
would be this thing right here.
Exactly.
Yeah.
That's
Oh,
the
look,
best
there's
septum.
a
And it
little
has-
vein that feeds it.
Yep.
Huh? It's a what?
There's a little vein that feeds it, the little dot there, right?
Yep.
It's a little vein that feeds. So that would be called a
Coronary vessel.
I was gonna try to guess. I mean, I was gonna try to remember, not guess. Okay, so the vena cava, it confuses me a little bit. I'm not sure.
It's
That's where the
Hold on.
veins come into
this one, I
the
think.
heart.
No.
That is the vein that comes into the
Hold
heart.
on.
On the
Vena
right
cava
side.
on the right side.
Yeah, it's the
think
vein
it's
that comes
this
into
one.
the right atrium.
So it's actually getting blood from the body. So
So you've
vena
got a
Is it- I
cranial
think
vena
it's this
cava,
one. I think.
And you've got a caudal vena cava.
is that this right here? How it has two different branches? You
This
can
right
really
here
see
is
it
your
on the
caudal
dog.
vena cava. okay?
There's one over here.
And then
you
this
can
is
see
the
where they
cranial
join.
vena cava.
You can see where they
And
join
they join together.
On
right.
on the dog, you can really see. You
Yeah.
can see where the two branches meet.
Well, on this one, you're not going to see that. Okay, so here's the caudal vena cava coming in. Here's the cranial vena cava coming in. They're going to actually enter at two different points.
Okay,
Okay?
so it's a little on the right atrium, so it'd be on this side.
It's really hard to find it because it's flat.
Yeah.
Okay, because the veins are always going to be flatter. They don't have as much wall thickness, right?
There's one of them coming.
You're in there.
Right.
That's it.
You were right.
Yeah.
So that's one vena cava.
Okay.
Wouldn't this be the vena cava? No, that's the artery because it's so thick.
Right, it's very thick.
Okay. And let's try over here. See if there's something over here.
If you're going the left atrium, what kind of blood
Where's the
comes in
same
there?
one? Left atrium.
Uh-huh.
It is coming from the lungs. It's highly oxygenated.
Okay, and what's the vessel it has to travel through?
What's the what?
The vessel, what vessel?
Pulmonary vein.
Right.
Vein, yeah.
It's the only
Because the
vein
arteries
that's
in the bottom.
highly oxygenated.
Right. And what's the only artery that is low on oxygenation?
The pulmonary artery.
Very good. If I was a fetus, which one?
Phosphovalus.
Huh?
Phosphovala. I know that one.
Foraminal
Hormone, yeah.
Yes.
I think
If I
I
was
put
a
that one.
fetus, where would my oxygen be coming from?
Your mom.
Which blood vessel?
I think it comes from the right one, doesn't it? The vena cava? No? I need to look that up.
It would be the umbilical vein.
The umbilical vein.
Okay. And then the deoxygenated blood going out to the placenta through the umbilical artery. So those are the only two that are weird. The only two, the only four blood vessels that are strange. Okay, as far as oxygenation goes.
Because the baby
Right.
has the oxygen.
Exactly.
And the pulmonary artery, pulmonary vein, and the fetal thingy. Okay, that's three? What's the fourth one?
No. The umbilical artery and vein.
Okay.
Okay, are going to be different.
And the pulmonary artery
and the
and
pulmonary artery and vein in the adult.
Okay, so that's 2 or 4.
That's
depending on
four.
how you count.
Four, yeah.
Okay. All right. So the aorta and branches are going to be red because they're going to the body, and they will be highly oxygenated, and they're going to be thick because it's an artery, and it will be coming from the right ventricle. No. Yes. No, left ventricle.
No, left, yeah.
Left ventricle, because so that's the one that kind of crosses up all weird.
Yeah.
It goes out like a back door.
He comes up behind. You know, you've got your mitral valve, right?
This
so your
one.
mitral valve is like right here, and the aortic valve sits right next to it. Okay?
It's sort of the diagrams I was looking at. It sort of almost kind of goes back through and up the heart, like a slide, like a roundy, slippy slide. Because it turns. It's not straight. Like you think left atrium
It kind of
is going
comes
to go
up
down.
and goes a little bit to the
Behind,
left, but not a whole lot.
Well,
I thought this
when
was
I
the
drew the
pulmonary
pictures, I was
vein.
thinking it would just kind of go down. But when I was looking at the heart,
Because all the blood vessels are basically coming off in the same spot. All right.
Really?
Unfortunately, yeah.
Oh.
So we've got
Isn't this
the
the pulmonary
aorta coming
vein?
up this way, and the pulmonary artery is coming up
it
this way.
should be coming from here.
So.
No, it's going to be an artery. That's a really thick wall.
What are you looking for? Aorta?
Pulmonary artery.
Hold on. You're not going to find it in the atrium.
It needs to go down here.
You're going to find it in the ventricle side, right? So here
Is
it is.
this it?
Here's the pulmonary artery.
Oh, that's the vein we found earlier. That's the right.
That's not an atrium.
That's the right side. This is the left side here.
This is the right side. You said pulmonary, right? Pulmonary artery?
No, aorta.
Oh, I'm sorry. Here's the aortic valve right here.
Oh, okay. So that makes sense. I need to